Hi there, and welcome to this special webinar, Pregnancy, Birth and Postpartum Tonics. I'm super excited to have you here today, so let's dive in. Please, if you can turn off all distractions. This is a very short webinar, but it is jam-packed full of really helpful information. So first of all, if you're not familiar with me already, my name is Kate. I'm the founder of Little Yarrow. I am a naturopath and a postpartum doula. I'm also a mum of 3 with over a decade's worth of experience working with and supporting mothers. So I use herbal medicine, nutrition, and traditional practices to support women make the transition to motherhood and nurture them throughout the early years and beyond. I also mentor many midwives, doulas, and women's health practitioners on how to educate their clients on how to use herbal medicine safely during pregnancy, birth, and postpartum. So today I'm going to be talking about herbal tonics for pregnancy, birth, and postpartum, and how you can utilize them in your own motherhood journey or use them to support other mothers. So today we will be covering a classification of herbs known as tonics, and I'll be covering 4 different types of these tonics, including nutritive tonics, uterine tonics, adrenal tonics, and nervine tonics. So stay tuned to the end as well, because I will be talking about a special offer. So first of all, let's talk about what a tonic herb actually is. So a tonic herb has a strengthening and tonifying effect on specific organs. So for example, a uterine tonic strengthens and tones the uterus, and a nervine tonic strengthens and tones the nervous system. So they are considered very safe and very nourishing and can be used long term. So why would you want to use these tonic herbs in pregnancy, birth, and postpartum? So tonic herbs are such a wonderful addition to supporting you throughout this time. They help to support both physical and emotional well-being, as well as prepare your body for birth and support you through the transition to motherhood. So they are safe, they're effective, and they're easily accessible. They have been used for thousands of years throughout many cultures, particularly by midwives and birth keepers and herbalists to support women during this time. So first of all, let's talk about nutritive tonics. So nutritive tonics are rich in vitamins and minerals, otherwise known as nature's herbal multivitamins and multi-minerals, and they are wonderful at helping to support the nutritional demands of pregnancy, as well as restored nutrient levels after birth. So they're also great for supporting the nutrient needs during lactation, which surprisingly are actually higher than pregnancy. So some examples of nutrient tonics include alfalfa, dandelion, red clover, raspberry leaf, stinging nettle, and yellow dock. And then we have uterine tonics. So uterine tonics increase the strength and the tone of the uterine muscle, which helps to prevent cramping and spasm. So some examples of uterine tonics include beetroot, otherwise known as birth root, false unicorn root, black cohosh, and blue cohosh. So you may be wondering what about raspberry leaf? So raspberry leaf is actually technically classified as a Partus preparator, same as squalvine, which is very similar. These herbs are usually used in combination traditionally, and they're used to prepare the uterus for birth. So they do have many similar properties to uterine tonics in the way that they help to strengthen the uterus, but they are more like specifically for preparing for birth. Whereas the uterine tonics, they're definitely used, for in labor, but they also have a lot of other uses for menstrual health and supporting women with things like fertility and period pain. But yeah, they're often used as well for like natural induction of labor, which is where black and blue cohosh are often used in these different situations. But they do, Partus preparators and uterine tonics have very similar actions. So next is adrenal tonics. So adrenal tonics help to strengthen and tonify the adrenal glands, and they sit above our kidneys and are responsible for the release of stress hormones, adrenaline, noradrenaline, and cortisol. So adrenal dysfunction can occur due to severe acute or chronic stress. So things like birth trauma, just having a really rough time postpartum, like lack of support, if there's any kind of challenges, sleep deprivation, often this can cause adrenal dysfunction. So that's where these tonics can really help with withdrawing that adrenal function. So some examples include licorice and Romania. You do have to be careful with licorice in women that have high blood pressure. In that case, I'd be opting for Romania. Romania is a really awesome herb. It is a traditional Chinese herb, and it's also specifically indicated for postpartum as well. The next category is nervine tonics. So nervine tonics help to support, nourish, strengthen, and tone the nervous system, and are really great to use during times of stress, overwhelm, anxiety, and depression. So they're really helpful for calming the nerves during labor, supporting postpartum mood, including navigating the common baby blues, as well as postpartum anxiety and depression. Nervine tonics include bacopa, gotcha cola, oat seed, motherwort, St. John's wort. You do have to be careful with St. John's wort. It does interact with a lot of medications, including antidepressants, migraine medications, hormone contraception. So you do need to be careful with this one. Skullcap and vervain. So if you've always wanted to know more about how herbal medicine can support pregnancy, birth, and postpartum, herbal medicine really is an amazing tool. Yet many women feel really uncertain about what herbs to use and for what reason, which ones are safe in pregnancy, which ones are safe in breastfeeding. And so that's why I've created my program, or my mentorship program, Herbal Medicine for Birth. So this is where I teach in depth all about herbal medicine for pregnancy, birth, and postpartum, including what herbs to use for different goals and ailments, how to use them safely, types of preparations, and so much more. It's jam-packed. There's 5 in-depth self-paced video modules. There's 4 bonus video lessons. You get my apprenticeship handbook PDF guide. You do get lifetime access. You also get direct access to me, because when you log into the portal, you can actually submit questions for me to reply to. And you also get the option to apply for a certificate of completion as well. So the topics included in the modules are the Mother's Herbal Compendium, which is a collection of my favorite herbs for supporting mothers during pregnancy, birth, and postpartum. Herbal medicine for pregnancy and birth, herbal medicine for postpartum and beyond, understanding herbal safety for pregnancy and lactation, DIY herbal remedies for motherhood, how to prep your herbal birth kit, herbs for pregnancy loss. This includes prevention, treatment, and recovery. Herbal remedies for postpartum hemorrhage. Once again, this includes prevention, treatment, and recovery as well. And herbs for healing birth trauma. So today I want to give you the special offer of $200 off for the early bird pricing if you join this week. Please have a look below, find out more about the course, find out more about the early bird pricing. There is a payment plan, and you do also get a couple of bonuses with my ebook, Botanical Medicine for New Mothers, and my homeopathic birth reference chart as well. So I hope you've enjoyed this webinar. We've just scratched the surface today, covering herbal tonics for pregnancy, birth, and postpartum, but there is so much more to learn. We go so much more in depth in the program, and I really hope that you will join me in learning about the wonderful world of herbal medicine for birth.